You're viewing this video because you and I have discussed the possibility of doing hip arthroscopy for treatment of femoral acetabular impingement and or a labral tear in your hip, which has caused you pain in your hip and decrease in function because of hip pain. The hip joint consists of two bones. There's the acetabulum, which is the socket side of the hip, and then there's the ball side of the hip, or the femoral head. The labrum is a rim of cartilage that rims around the socket and sort of acts like a gasket for the hip. So it's cartilage that goes between the femoral head-neck junction and the labrum and acts to give a little bit of extra stability to the hip. Normally, a hip is smooth in this area, and normally the femoral head has a concavity both on the inside of the hip and on the outside of the hip. In cases of FAI, there is decreased room. For instance, with pincer type impingement, there is extra bone off the socket, and this is going to be represented by my thumb. In cam type impingement, there is extra bone off the femoral head-neck junction, which is going to be represented by my index finger. If you imagine that the labrum is jutting just past where my thumb is, you can see that with less motion, you can start to engage the labrum and start giving a crush and tearing effect to the labrum with repeated range of motions over a long period of time.